Tonight, Utah taking a side in the renewed debate over fluoride in drinking water. On Thursday, Governor Spencer Cox inking a law that bans adding the mineral to public water sources starting in May. Years of research have found adding fluoride to drinking water reduces tooth decay up to 25%. That practice began in 1945. Known as fluoridation.
The Centers for Disease Control and Prevention included it as one of its 10 great public health achievements of the 20th century because it literally changed the face of America.
The American Academy of Pediatrics and the American Dental Association both support its use.
Fluoridated water is medicated water.
But the movement to ban fluoride has gained popularity across the country, with proposed legislation in Florida, Kentucky, Montana, and Tennessee.
It was the only chemical we add to our water that's intended to treat the consumer and not the water itself.
The Fluoride Action Network says more than 1,500 communities have stopped adding fluoride to their systems at the local level since 2010.
I would say I just feel like it should be a choice of each person.
Health and Human Services Secretary Robert F. Kennedy Jr., among the most vocal of critics, posting on X late last year that the incoming administration would advise all U.S. water systems to remove fluoride from public water.
I think fluoride is a poison.
The secretary associating fluoridation with illnesses like bone cancer, the CDC says scientists have not found enough evidence to support a link. One JAMA pediatric study published earlier this year did find an association between higher fluoride exposure and lower IQ scores in children, but the American Dental Association says the data is flawed.
3/4 of the studies that were included were, by the author's own admission, very low quality studies at very high risk of bias, none of which were from fluoridated areas.
Miami area dentist Raul Gonzalez says he's noticed some issues in some patients who are avoiding fluoride.
I'm seeing a lot of new patients with my 5 doctors here that we're seeing a lot of cavities coming back because there's a lot of propaganda saying that fluoride is really bad.
Dr. Gonzalez says becoming hyper-focused on fluoride can draw attention from other important risk factors for whole body health.
Most important thing is good dental hygiene. Brush, floss, the water pick. Second, eliminate the sodas and the drink that have bubbles. Now you add to that sugar and you add to that colorants, now you have cavities, digestive issues, and the probability of cancer-producing or cancer-transforming cells.
And George Solis joins us now from our Miami bureau. George, as you were speaking with dentists, did any of them mention a circumstance where fluoride could be dangerous?
Yeah, Elson, it's important to note, according to the CDC, the real only documented negative effects of too much fluoride would be a discoloration of the enamel, that covering around your teeth, and small holes. But even in countries where there is high levels of fluoride, it far exceeds anything that we see here in the United States. And as you heard from the dentist there in our report, Dr. Gonzalez there, look, anything in excess is not good for you. He says what we see here with our moderate levels of fluoride in our water shouldn't be harmful, but of course the best thing to do is to obviously check with your dentist, check with your doctors about any concerns you may have about fluoride.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.